My name is Allan. I'm the functional manager of the bioservices group at Starfish Medical. When I'm tasked with developing an assay, I'll often look to kinetic-based assays. And kinetic-based assays are, as the name implies, looking at a change in a reaction over time. The reason why I like kinetic assays is several-fold. Number one is cost reduction, both on the ultimate device and on the time to development side. And I'll tell you about that. So on the device side, often we'll look at fluorescent-based systems. And if you're looking at it, particularly if you're doing a microbiology system, sometimes those systems are disposable, right? Throwing away the thing at the end of the day. And so if you're throwing away a really expensive photospectrometer, that's not very good for the bottom line. And so you'll want a system that's very inexpensive, and a good way of getting around that is a kinetic-based system. It's just looking at an increase in signal over a noise floor, so that's really handy. Same goes with the chemistry. If you're in the early phase 0 development phase, as we often are, often the design freeze hasn't happened yet. You're experimenting with the formulations and trying to figure it out. And if you're working with a kinetic-based system, you want to be very tight with your tolerances. You can do a lot of early development work and really tighten things up before you get to the design freeze stage. Another really cool thing about kinetic-based systems is that because you're just looking at an increase in signal over time, there's a slope element to it. And depending on the amount of analyte in there, it increases the slope, and therefore you can detect the level of analyte that is in that sample, which is super handy. Another really interesting thing, probably one of my favorite things about kinetic-based assays as opposed to endpoint assays, is it can overcome what we call the hook effect. The hook effect is a really interesting thing where you see as the analyte increases, you see the signal go up, and then as you get to a point where there's so much analyte it interferes with the signal detection, you see the signal drop, giving an artificial false negative. And that's a terrible thing. You'd imagine, you're trying to detect COVID-19 and you've got a negative and you're really well above the signal threshold. Oh my gosh, it's terrible. So in an endpoint assay, you'll just see that final part after the hook. But in a kinetic-based system, you get to see the whole range of that detection profile, and you can eliminate that failure mode. Very powerful. The final thing, well, there's many things, but one of my most favorite things about kinetic-based assays is that you can often spike your system with an interferent that you're really having trouble getting around. Now, we're doing systems that uses blood plasma or urine even, or serum. Those are nice, clean samples compared to saliva, which, this is a sewer, and even worse, feces samples, which is literally a sewer. And so there's lots of interference in there. As a microbiologist, one of the interference I'm often dealing with is LPS, or lipopolysaccharide. So a common trick that we will do, we're designing a kinetic-based assay, is we'll spike with LPS, and then the noise floor is at that level. And then because it's a kinetic-based system, when we detect any more of that signal, it's an increase above the noise floor. So it eliminates a whole bunch of screening shenanigans that we have to do at the front end. So it's very, very helpful. And those are a number of reasons why when I'm tasked with developing an assay system, I'll look at kinetic-based systems. And in fact, I wrote a whole blog just about this very topic. And if you're interested in learning more, really encourage you to look at our list of blogs, and hopefully you'll find me there and find that helpful.